Also, do you feel that these problems can be solved by going to the gym or maintaining proper diet? So
Lot of these
basically,
problems can
can
be
be solved, but
solved.
they are basically looking for a easier way out where they just go, they do the plastic surgery and they think the problem is
I
going to be
don't see
solved.
it's an easier way out. They still have to do the lifestyle modifications. And the thing is, they are all going for perfection. But being perfect doesn't mean that it will make you look beautiful. In
Absolutely.
fact, yes.
Absolutely.
In fact, there was a study where they had 100 faces. So I think 95 to 97% of us have not perfect faces.
I'm telling you one thing, I'm interrupting you. If there is something imperfect that makes
More beautiful.
that makes more beautiful, that makes another person to look more than once.
Yes.
So,
So
The smile of Mona Lisa is not perfect also. There are lots of studies that this smile, there is one study that this is a kind of a paralysis in the face for which the smile is like that. But Mona Lisa is beautiful. So people have to know that everything is not perfect, and imperfection makes a man
perfect
or a person
is
beautiful.
perfect isn't equal to beautiful.
Exactly.
So this study where they collected 100 pictures of people, and they were all of us are imperfect. One side of our face doesn't match the other side. So what they did is they cut the faces into half and replicated the other side. And they came to know that the imperfection was making the face look more prettier, more beautiful. And if you have the exact angles, exact jawline as the other half, it will not make you look good.
Interesting.
So, yes.
Yeah. So when they say certain actors have like the exact, the same replica on the other side also, and the most perfect looking man or perfect looking woman, it's incorrect,
Yes,
basically.
and you don't tend to remember that face.
Yeah,
You tend to remember a mole on that face. You tend to remember a dimple on one side. If one eyebrow is more arched than the
two
other.
different eye colors, yeah.
There's a study that the most perfect face of today's world is the face of Amber Heard.
Go. Wow.
There is a study,
Yeah.
and it showed that her facial proportions are most perfect,
Yeah.
but she's not
She's not the most
among
desirable, I think.
top 10.
Prettiest, yes. I am
or
so
the prettiest.
almost sought after. let's
Sought
say.
after, exactly.
But while we are speaking on dysmorphia, you both have been specializing in your job, say for a decade or so now. What do you say, more than that, and of course, but would you say cases of body dysmorphia has increased over the past decade? Or is it just that people are coming out and talking about it? What?
People are now coming and talking about it, probably.
It's always been there, but now people are more vocal about it.
Before we answer that, can you define what exactly body dysmorphia is? Because I think a lot of people have heard it, talk about it, but they don't know what exactly they suffer from it, but they don't know what body dysmorphia is. So if you could just define it.
Definition is a bit difficult, but body dysmorphia is basically one is constantly not happy with his or her body images. That is body dysmorphia. And we get a lot of patients of body dysmorphia. Even I have seen a patient who has done corrective rhinoplasty for nose, person who is a serial actor, Bengali serial actor, and he has performed, he has gone to different plastic surgeons and has been operated 23 times. Still
He's still
not
on the
happy.
nose.
And still not happy. And he has sued most of the plastic surgeons.
Oh, so 1 second, I shall interrupt. 23 on the nose?
on the nose.
Just on the nose.
Wow,
So
he
it's
seems
like-
to have beaten Michael Jackson.
Yeah, exactly.
So no matter what you do, you will be unhappy in your skin.
Yeah, and skin. Yes. So body dysmorphia, the first time I came across the term was when I started going to the gym, and then a lot of people seem to be having body dysmorphia, especially if they start going to the gym. And then that is when I started researching what it is, and I got to know that the more the people get into workout and stuff like that, more they get into body dysmorphia, where it does not even exist. It's just in their mind. It is not something that is happening to them, but they feel that way. Why do you think people trust unqualified skin artists or aesthetic technicians more than dermatologists, cosmetic surgeons, and plastic surgeons? And what reason is it? The cost, the speed of recovery, which they are told maybe it's going to be faster, or most probably it's the money. Is involved. So what do you
Most of
think?
the
is it?
cases, it's money,
Okay.
because unqualified person, that will be cheaper. Of course, that will be cheaper. Another thing is, in most of the cosmetic procedures, you won't get the help of Medicare. Most of the people have Medicare, but these cosmetic procedures or aesthetic procedures, they are not covered under Medicare, and they are saying that this is cheaper. And also there are influence of advertisement also, a big influence of advertisement.
Of course. So, how about you, Akanshi?
Yes, definitely they are cheaper, but aestheticians, they are easily accessible. They're easy to talk to also. So as clinicians, I think when I talk about my whole fraternity. We should make out a little bit more time with the patients, just not put the entire blame on them, so that we are easily accessible. We give more time to them while talking. And most of the options that are given to the clients are nicer options. They are relaxing services, like they'll give them an option of a spa or like a facial, something like that. But we will say the ugly truth out loud, which is not nice. So I think we should work on the way we are talking. We have to be milder. This is what I think we as a fraternity should be doing. At the same time, yes, cost is a thing. Social media, yes, they put out reels which are so well edited. I get hooked to them. And sometimes I like, okay, they are saying it. So you are sold there. Like, one facial can solve these many problems for me. So yeah, everyone is on social media, and they're very good with editing and all that, and it's really believable what they show online. So
So when they are going to these kind of unprofessional people, so what do you think the disadvantages are? Suppose there's a very complex plastic surgery someone wants to get done, but because of the cost and they are not getting the insurance done, they go to these unprofessional people, maybe not even in our country, in some other country. So what do you think the result is, the end result is, or what are the disadvantages that may or may not happen?
There are lots of disadvantages. In madam's topic, I know there are lots of skin bleaching creams available which are high concentration of steroid. Probably the Society of Dermatology moved against that, and
over-the-counter drugs.
yes, it has been banned. That
It's banned, but
without
in India, it's
without
been
prescription, you cannot buy a topical
So the
steroid.
cheapest way you can become fair is by applying steroid. Okay, so you keep on applying it for
Lots
years.
of fairness creams also.
Yes.
And that destroys the skin.
Yeah, and then when you come to me, I have a papery thin skin I cannot work on. I have to.
There was a male face cream for
Yes.
making people fairer. That had
Should have
high
been-
quality, high concentration of steroid.
Such funny. I had my engagement, and my husband, who has never ever done anything to his skin, he was glowing on the day of my engagement, and I pulled him aside because I have done so much on me, and I was like, "Listen, tell me, what have you been doing?" And he exactly named
Okay, anyway, we won't
that
name
same
it.
brand. We won't name it. It's like I've been applying it for a week because I was getting married, so I thought I should do something. I said, "Wow, you're going to be married to a dermatologist." So it's happening with all of us.
Yeah.
So
But then I hope it stopped after that, after he got
I
married.
made him stop.
Yeah.
I was in charge.
The price of hiring a dermatologist.
She was like, "You're married now. Don't be glowing anymore."
So it's quick. It's a quick fix.
Yeah.
So us as professionals, we give we give fixes which are backed by science, and they give quick fixes, which might not always be the best option. Yeah. It's good cosmetically, but definitely not always the best option.
Yeah, there are long-term effects,
Yes.
right?
Yes.
Which are irreversible most probably, most of the time. That's why professionals are important.